Welcome to The Explainer. In just about 5 minutes, we're going to break down a really powerful medicine called Mometasone. We've taken all the complicated science and turned it into a straightforward guide so you can really get a handle on what it is, how it actually works, and why you see it used so often.
So here's how we're going to do it. First, we'll get to know mometasone itself. Then, we're going to shrink way down to see its mission inside the cell. From there, we'll check out all the different forms it comes in. It's like a multi-tool. Then we'll cover the really important safety stuff, the rules of engagement. And we'll wrap it all up by talking about why this medicine is such a big deal.
Okay, let's dive right in. First things first, before we get into the nitty-gritty of how it works, we gotta understand what kind of medicine we're even talking about here. So at its heart, Mometasone is what's called a potent synthetic corticosteroid. Now that sounds complicated, but all it really means is that it's a powerful, man-made version of a hormone your own body produces to fight inflammation. Its whole job is basically to tell your immune system, hey, calm down, you're overreacting.
And this is a really important point to get straight. You hear the word steroid, and your mind probably jumps to anabolic steroids, the kind used for building muscle, but that's not what this is. Mometasone is a corticosteroid. Its job is totally different. It's all about reducing things like swelling, redness, and itching. It has absolutely nothing to do with building muscle.
Okay, so how does this inflammation fighter actually pull off its mission? Well, this is where it gets really cool, because the whole process is incredibly precise, and it all goes down at a level you can't even see.
It's basically a 4-step mission. First, the medicine has to get inside the right cell. Once it's in, it connects with a very specific receptor. Think of it like a key finding the one and only lock it fits. This new combo then travels right to the cell's command center, the nucleus. And here's the amazing part. It literally starts changing the instructions. It's like a new manager walking into a factory, shutting down the production lines that are causing all the inflammation and firing up the ones that stop it.
And the result of all that genetic micromanagement? Well, it's exactly what we want. Everything just calms down. By getting right to the source code, Mometasone dials back that overactive immune response, giving you relief exactly where you need it. Okay, so we know how it works on a tiny scale, but how do we actually use it? Well, this one medicine comes packaged in a few different ways, like different tools for totally different jobs. And believe me, how you deliver it is everything.
First up, you've got the stuff for your skin, the topical versions. You'll see it as a cream, an ointment, or a lotion. You just apply it right on the skin to deal with things like eczema or psoriasis. And the form really matters, by the way. The greasier ointments are perfect for those really dry, scaly patches, while the lighter lotions are much better for hairy areas, like your scalp.
Then there's the nasal spray. This is a huge one for anyone dealing with allergies, the sneezing, the stuffy nose. But here's the key thing you have to remember. This is not an instant fix decongestant spray. It's a preventer. That means you got to use it regularly for it to work. It builds up over time to keep that inflammation in your nose under control.
And last but not least, the inhaler. This is your daily maintenance tool. Its job is to prevent asthma attacks before they even start by keeping the inflammation in your airways low. Now listen up, because this is the most important point I'm going to make. This is not a rescue inhaler. I'll say it again, it is not for when you're having an asthma attack. It works way too slowly for that, and it will not help you in an emergency. So we've got these really powerful specialized tools for the skin, the nose, and the lungs. But you know what they say, with great power comes great responsibility. To stay safe, you have to know how to use them the right way. So let's go over the rules of engagement.
Okay, side effects. Most of the time, they're local, which just means they happen right where you use the medicine. So you might get some skin irritation from the cream, or maybe a little nosebleed from the spray. The more serious stuff, called systemic effects, are way more rare. That happens if the medicine gets into your bloodstream and starts traveling around your whole body. And that right there is exactly why sticking to your prescribed dose is so important.
And here's a key tip, especially for anyone using the inhaler. It's a super simple habit, but it makes a huge difference. After you take your puff, just rinse your mouth out with some water and spit it out. That's it. Doing that one little thing is amazing at preventing a really common side effect, a fungal infection in your mouth called oral thrush.
And of course, there are a few other big rules. You definitely don't want to use Mometasone on an active infection, bacterial, fungal, whatever, because it can actually weaken your body's ability to fight it off. It also needs to be used really carefully in certain situations, like during pregnancy, and it can mess with other drugs you might be taking. The bottom line is, you have to tell your doctor everything about your health history. No exceptions.
All right, let's wrap this up and look at the big picture. We've seen what Mometasone is, how it works, its magic at the cellular level, and the right way to use it. So, what's the big takeaway here? Why does this one medicine matter so much?
You know, this quote here really nails it. It's the golden rule for using Mometasone, or really any corticosteroid. Use the lowest possible dose that still works for the shortest amount of time you can get away with. It's not about blasting the problem, it's about finding that perfect balance to keep things under control.
When you get right down to it, Mometasone is a cornerstone of modern treatment for a reason. It's this incredibly precise and powerful tool that, when you use it right, gives people control back. It helps manage chronic conditions like asthma, allergies, and eczema, things that, without it, could really get in the way of just living your life.
The way Mometasone can go in and so precisely target inflammation at the genetic level, it's just an amazing example of how smart modern medicine has become. Understanding how it works is the first step to using it well. And it really makes you wonder, doesn't it? What other complex medical mysteries are just waiting for us to unravel next?